President and CEO of the California Institute for Behavioral Health Solutions, Percy Howard.
Good morning, everyone, and we want to thank you for joining CIBHS as we begin our 5-part webinar series, Eliminating Inequities in Behavioral Healthcare. This series is focused on building will, skill, and strategies to eliminate racial disparities in access to behavioral health care and increasing the quality and positive outcomes of that care. In short, our aim is to increase behavioral health equity in Black and Brown communities. Today's module lays the groundwork for the series by introducing a framework for confronting racism in behavioral health. Over the course of the next 4 weeks, we will have modules which build on each other and address topics critical to moving towards behavioral health equity. CIBHS will first examine the impact of institutional and structural racism on behavioral health outcome disparities. We will then sponsor a webinar that invites participants to consider how implicit bias and racialized identities impact their professional, internalized sense of self, their interpersonal relationships, and their professional practices. We will then invite behavioral health leaders to discuss their responsibilities to address racism and explain how they've done this or how they plan to do this in their organizations. Finally, we end the series with a skill-building webinar that aims to assist participants to initiate dialogues on race, racial identity, and racism with their clients. I'd like to thank DHCS Director Will Lightbourne, Dr. Kelly Pfeiffer, and the leadership of the California Department of Healthcare Services for sponsoring this series, as well as CBHDA Executive Director Michelle Cabrera, Dr. Jay Africa, Marin County Behavioral Health Director, and Ann Robin, San Luis Obispo County Behavioral Health Director, for being committed, agile, and dedicated partners in the identification and presentation of key components of this work. CIBHS also thanks the leadership of the statewide associations, including the California Council of Community Behavioral Health Agencies, the California Alliance, the California Primary Care Association, and others for their ongoing partnership and leadership regarding organizational efforts across systems to increase innovation, capability, and collaboration regarding the equitable delivery of behavioral health services in Black and Brown communities. The current environment in which we find ourselves, excuse me, is indeed unprecedented. A perfect storm of COVID-19, the nationwide awakening to the impact of police violence on Black and Brown lives and communities, and a level of economic devastation not seen since the Great Depression has been catastrophic and extremely difficult. But it's also resulted in communities, behavioral health organizations, educational organizations, and law enforcement entities demonstrating an increased willingness to share power and authority and to engage in difficult internal as well as external conversations regarding disparities in service and care to Black and Brown people. These modules were created to be a potential jumping off point and support for California behavioral health payers, providers, and associations to increase our collective impact in support of the needs of Black and Brown communities. Thank you all for your dedication to the struggle. Stay with us, please, over the next 5 weeks for difficult, innovative, exciting, and wholly necessary conversations. With this, I'm going to turn the proceedings over to CIBHS Director of Strategy, Jen Clancy.
Hi, everyone. I'm really excited to see how many people are with us today. We have over 1,800 people. We know that this is a really critical topic, and we're so happy you're with us today. I am very proud to be able to introduce our two speakers, Dr. Jay Africa and ADèLE James. Dr. Jay Africa is the Director of Behavioral Health and Recovery Services at the County of Marin. He's an experienced clinician, an innovative thought leader, and strategist. Dr. Africa is passionate about integrating effective, culturally responsive practices into the core function of county health services. An activist and a storyteller at heart, Jay believes that love and justice are essential ingredients in helping people thrive and collectively transforming communities. ADèLE James is the CEO of ADèLE James Consulting. She brings more than 20 years of experience in public, nonprofit, and philanthropic sectors, including 11 years in foundation grant making with 3 different California foundations. She brings comprehensive expertise as a funder, an organizational development consultant, a university faculty member, and an executive coach. Her services include program planning and design, participatory action research, training, executive coaching, and assessment and implementation of organizational equity and inclusion practices. As part of the initial $140 million disbursement of the Mental Health Services Act statewide prevention and early intervention funding, ADèLE co-facilitated the proposal review process, and she also developed recommendations for grantee capacity building. ADèLE is a native of Trinidad, West Indies, and she's very, very passionate about improving programs and systems to serve increasingly diverse communities. Another great fact about ADèLE is that she loves the adventure of international travel. She's working on a forthcoming book of stories and photography of the work of artists and artisans in Trinidad and Tobago. She holds a BA from Barnard College, Columbia University, and an MA from Stanford University in International Development and Education. And now I'm going to turn this presentation over to Dr. Africa.
Morning, everybody. Thank you for being here. I just want to take a moment to recognize that we are really in a difficult time, and we can just take a breath as we start this conversation, hopefully, about how to bring discussions of racism and really addressing that in actually our system. So what we wanted, ADèLE and I wanted to do, was to really start a conversation about, answering the question of, when you reflect on this current time, what is your current understanding of where we are? So that really is sort of our opening to just help set up where we are. So ADèLE, you want to take that away?
Yeah. So good morning, and I do feel encouraged by seeing the number of people who are here, and my hope is that through this webinar and this series, that can support you in taking some action. I can't begin to talk about where we are now without looking back on where we were almost 4 years ago. And I think about the impact of that last election and the messages in the broader culture that were being reflected about who I was as a woman of African descent, as a woman, as an immigrant, as someone who is queer identified. And that in its totality, what I heard in those messages was that I was not welcomed, that I was lesser. And so we can look at it as a political situation, but I know how I felt the emotional consequences of that, which was really fair. And as someone who's used to going wherever she wants and who's done rural work, to confront my feeling of fear in that moment. And, I wondered, are people not seeing what I'm seeing? So if I bring it back around to where we are now, there is some hope here, because it's like, are people now starting to see and understand the impacts of structural racism, not just politically and economically, but the consequences and the trauma that it can cause emotionally?
Yeah, and I think it's just for me, and I wanted to stay really grateful that there's almost 2,000 folks on the webinar. And what really strikes for me at this time is that folks who have been in this struggle, they have sacrificed their lives and their families' lives to really move forward with really providing equitable opportunities for folks. And finally, there's sort of a merger of the folks that didn't quite understand it, didn't resonate with it, this is not their lived experience, are hopefully finally coming together to talk about, if we are going to survive, if we are going to thrive, we really need to come together and be partners and collaborators in this work to really figure out how we transform the way we do our work, so there's more, so that we can all be really engaged and thriving in this society. I am as hopeful. I will say that I have actually been very emotional this last few months, but I really am very hopeful. And I ask myself every night, how do I show up when the time comes that people are going to ask me, what did you do during that time? Mm-hmm. And I'd like to say I was part of that really as a solution to really help people change their lives and the narratives of people's story. So thank you for that. So what we'd like to do now is actually ask you a couple of polls. So the first poll, next slide, please, is the first poll that we want to ask you is, what keeps you from taking action to advance equity and confront racism where you're at? What keeps you from taking action to advance equity and confront racism? So maybe about 15 seconds more. And then our second question, next slide, please. What keeps you? Oh, okay, so thanks. Thank you for that. So we wanted to just make sure that we show this results to you. Fear of retaliation, being viewed as a troublemaker, fear that will change if I say something, fear of being seen as weak, and fear of saying the wrong thing. So I'm really glad then for folks that were honest enough to say of saying the wrong thing, that you actually, hopefully this 5 webinar series will help you be able to have the tools to not to be perfect, but to actually start the conversation and have people around you be part of the conversation. So our next question, what would support you in moving beyond your fear, your worries, and concerns? What would support you in moving beyond your fear, your worries, or concerns? Maybe another 15 more seconds. All right, let's see the results. So peer consultation, about 16% of you, facilitated support groups, mentorship, and leadership development. So thank you all for indulging us in sort of responding to that. I think this is really a good sort of temperature for us to see what we can do and what CIBHS can do to help support this continued work. So I want to turn it over now to my colleague ADèLE.
Thank you, Jay. So, you know, the way that I'm going to approach this and is that I want to talk more about the internalized and the interpersonal aspects of racism and even some of those barriers. And Dr. Africa is going to talk more about the institutional and the structural and what you could do. So my push points are around the internalized and the interpersonal. And I wanted to start there because if we're going to take collective action, it also means that we have to start with the individual action. If we're going to have the organizational reckoning, there has to be that personal reckoning. So when we define the term racism, what is it? It's rooted in power, and it is about who has it and who has the decision-making authority, and it's about the use of that power that might be to the disadvantage or the subordination of a racial group because of bigoted attitudes. And when we talk about institutional and structural racism, that's something that is incredibly pervasive and embedded. And the thing is that those who have it, who benefit from it, often are not aware. So this is taken from a recent story in the paper about Merriam-Webster changing its definition of racism to include structural racism, to take a look at the systems. Now, the interesting thing is that the definition for systemic and structural racism has been around since the 1960s. The thing, though, is that it didn't make it into the dictionary or the consideration of it until 2020. So we're talking about 60 years of one, this discussion that racism is structural, and two, defining it as such. I think that that's an example right there in and of itself. And it makes me think, who's at Merriam-Webster? What is their lived experience about structural racism that it is even a concern? And so when we look at who has access and something as powerful as definitions and defining things, right? That it makes a difference who's at the table. And so this is only in the wake of George Floyd and the protests. This young lady, Kennedy, had just graduated from college. And when she was discussing this issue of structural racism, what she was hearing from folks is like, wait a second, that definition is not in the dictionary. And so she took action. She wrote to Webster saying, hey, you need to change this because what you're focused on right now is about attitudes and it's about prejudice. What it is you're not looking at are the consequences that result from those actions that are based on race. So you see down at the bottom here that this was the editor. She was surprised to get a response from the editor about, you know, how they need to be even more clear and expand the definition to include the term systemic. And that they will use examples. So, you know, when you think about what can I do and what's my role, she wrote a letter to the editor saying, you know what, your definition is off. I do think that the circumstances now help to contribute to that change, but that was what she did. Next slide, please. Next slide. Okay. So how do you know that an issue is about racism? You know it's about racism if it disproportionately or differently affects people of color, if it fits into a broader pattern of events that disproportionately or differently affect people of color. So you're looking at one, how it affects folks, and two, what you're looking for are the patterns. So how do you go about building an anti-racist organization? Because the reality is that our organizations and the way they are defined and developed are based on the larger society. So despite your best efforts, without an intentionality towards practices, policies that are anti-racist, you'll recreate what already exists. So the challenge is, how do we move from the goal and good intentions to implementation? A number of you spoke to in the poll, you know, some of your barriers, you know, and some of what it means is that you're going to have to challenge the status quo. You're going to have to maybe challenge how things have been done, the policies and the procedures. You may be going against the grain. It could even mean straining long-standing relationships. Now, you know, what I see that can be a challenge for folks is that they want to see change, but that what they don't always realize is that you need to get comfortable with the uncomfortable. And so that's, you know, in doing that, you may be bringing up conversations that you haven't had before. For whites, what it may mean is working to dismantle a structure that has worked to your advantage while systematically disadvantaging people of color. For people of color, there's an inclination to speak up, but also to an encouragement of silence out of fear that if you speak up, that might have consequences. The fear of the consequences of speaking up and the impacts that it might have on you professionally may be among some of the things that are barriers. And I want to name this because this is the stuff that I think people think and don't necessarily say out loud. So as you go into this, you know what you're dealing with. For a lot of folks who may not disagree about the impacts of racism, they speak to, and there have been surveys done that they're too busy. The problem here is that the topic of racism is not positioned as a core competency that is critical for moving organizations and also the careers of those in leadership forward. So you know what you're supposed to do when you're in leadership. You know, you keep your budget tight, you bring money in. This also needs to become a core competency. Have you created a diverse and equitable workforce? Have you created an organization that has a focus on anti-racism? So the problem is that building racial equity and by extension an anti-racist workplace it can often be seen as an extracurricular, and that people will fear that they're the worst case scenario, that detracts from, or expecting that it's going to go awry, that is going to take away from you even saying anything, but without even considering, if you say nothing, what are the impacts for Black, Indigenous, people of color? So nationally and organizationally, we have a blind spot. And here's what my concern is, that even in presenting this webinar, it might be seen as a means for implementation of tools, a task, without doing the personal work, the personal internal work. Behavioral health field, by its focus, is about improving emotional and psychological well-being. Issues of racism and discrimination have an impact and they cause emotional trauma. And that is the blind spot, that we're not looking at what is the impact of racism and discrimination emotionally on individuals, on entire communities. And so if that's a national blind spot, organizations are shaped by the culture around them. And so the concern is that that then shows up as a blind spot within organizations. So how do we make the blind spot visible? I think we need to think of systemic racism as a stream, and you're a fish in that stream. If you do nothing, just float, the current will carry you along with it, whether you're aware of it or not. If you actively discriminate by swimming with the current, you will be propelled further. In both cases, the current is going to take you in the same direction. According to Dr. Robert W. Livingston, and he is a lecturer of public policy at Harvard University School of Government at John F. Kennedy, when you think about systemic racism, it has less to do with what's in your heart or mind and more to do with how your actions or inactions amplify or enable the systemic dynamic already in place. So again, it's not about what's in your heart or your mind, but it's about the action you take or not take and how that enables the system. So anti-racism requires swimming against the current. It demands much more effort, courage, and determination than going along with the flow. The perpetuation of discrimination often comes from well-meaning, well-intentioned, well-educated, and open-minded individuals who are unaware or underestimate the impact of the cultural current on their actions, positions, and outcomes. Next slide, please. So where we find ourselves is at a crossroads. And when we look at the levels of racism, it happens at an institutional level, it happens at a structural level, but also too, there's the pieces of looking at where we are and the impact it has on us internally. So here's some data around the impact of racism. Next slide, please. So this is a snapshot of mental health disparities based on race. And you see with African Americans, mental health conditions, particularly schizophrenia and bipolar disorder, are more likely to be, they are more likely to be incarcerated than other groups when they have those conditions. For Latinos, US-born Hispanics report higher rates of most psychiatric disorders than Hispanic immigrants. And you really have to look at that. What is going on that someone born here has a higher rate of disorder than someone who is immigrated? And these are just some of the questions to take a look at. What is happening? When you look at American Indians, Alaska Natives, in 2014, suicide was the second leading cause of death for all between the ages of 10 and 34. And then among Asian Americans and Pacific Islanders, Southeast Asian refugees are likely to receive a diagnosis with post-traumatic stress disorder associated with immigration. So in the case of Latinos and Asians, this experience of being in the country can have an impact on your mental health. So you have to ask, what is going on in the environment? Next slide, please. So here's the interesting thing. When I looked at what were considered barriers to mental health services across racial groups, the common barriers across all of these groups was a lack of cultural competent providers and a lack of or insufficient health insurance. Both of those pieces are structural, okay? But then when you look specifically for African Americans and Native Americans, a key factor there was about distrust of the healthcare system and providers. And really what we're talking about there is on the interpersonal level and the internalized level. And if you know the history of African Americans and Native Americans, it makes sense that there is a distrust from the legacy of slavery to forcing Native Americans to reservations, but also the experience of Native American boarding schools. And so when we're working with clients, if you're not looking at the context and the history that structural racism has contributed, it leaves you at a disadvantage in terms of being able to know how to work with that client. And also, why are you getting, this distrust? Why are you not being effective? So the reality is that even if you don't think you are doing anything specifically problematic, without looking at the historical context and the potential trauma that a group has faced, you are going to be at a disadvantage to adequately address how to improve mental health outcomes. So we're at this crossroads. And, there's this saying that a little bit of recovery can ruin a good drink. Now, it doesn't mean that you're not going to pick the drink up anymore or again, but that little bit of recovery can mess it up because somewhere in there, you're thinking about maybe what you've heard. Well, I think that, this understanding that we're hearing more about of anti-Black racism and specifically discrimination of indigenous and people of color, it's kind of like, that little bit of recovery. You can't unlearn it. And the data is really clear on the impacts that discrimination has on people of color. So to not take a stand is to be complicit. To not engage intentionally in actively creating an anti-racist organization is to allow structural racism to become more embedded. So, this is not one of those things where one can be apolitical or not have an opinion. It means by not taking action, especially when we have an awareness that we're allowing policies and practices and procedures that govern our organizations to continue to support and reinforce negative outcomes for clients. So what is required is actively working towards creation of a governing framework that promotes equity. So I want to talk about legacies. And I think that our personal legacies, like recovery, are built one day and one moment at a time. So we often look back at those involved in the civil rights movement as being brave, as being heroes. And yet many of them were ordinary people who saw injustices and chose to take a stand because it was the right thing to do. Some of them, I'm sure, had bad days. and didn't want to go out there and didn't want to speak up, but they did. And their vision was the creation of a just world. So, my question to you is, have you ever wondered who you would be and how you would have shown up during the civil rights movement? Have you ever wondered what your family and their friends did during that time? Well, many are saying that this time now is our civil rights movement. What we do each day helps to create our legacy, our contribution to the society we want to see. So what, we talked about the barriers and the challenges. And so what do? What are those steps that you can take? The reality is that it's going to take some soul searching about what role you want to play. And some of it may be some uncomfortable truths. It may be conversations that you've not had before. And the thing is that, but in the recovery field and the mental health field, there's this understanding that if we don't acknowledge where our lives are unmanageable, if we don't take inventory and let it go, that if we really want to become of service, it requires those steps. And so, I looked at the example of South Africa when it ended apartheid, and I'm old enough to have been demonstrating in college. Part of their process was the Truth and Reconciliation Commissions, to talk about what happened, to talk about the impact on both sides, to say sorry, to acknowledge, to take responsibility. And I think that that's some of what we need to see in organizations. So, Dr. Africa is going to talk about the organizational level, but what this does is that we need to take a look at how our individual actions contribute to the larger organization. So start by speaking up, not assuming it's someone else's job to speak up. Address the microaggressions when you see them. And yes, it's important to be thoughtful and strategic, but that does not mean avoiding discomfort. And I think that that's a thing where a lot of folks think that, oh my God, this is going to be so hard. And you know what? It's about learning to be comfortable with the uncomfortable. And so that's some of what, and especially for those of you who are in positions of authority and leadership, make it a central tenet and demonstrate that an inclusive and diverse workforce and anti-racist organization is fundamental in successfully improving client behavioral health outcomes. And that's ultimately what all of this is about, how to improve outcomes for clients. So I want to conclude with, this is not about sympathy and how sad this is, but it's really about empathy. That are you understanding and feeling the impact of this to the point that you will take action? And what is that action? Because again, legacies like recovery, they're built on those moments. And so that comes down to each of us. What are we going to do in this moment? What will be our contribution? And so I'm going to turn it over to Dr. Africa. Thank you.
Thank you, ADèLE. Really appreciate sort of your framing. And so what I want to now move on to, so we talked about what racism is and how you see racism. I actually want to talk about how do we really confront this? Like, how do we really bring it in conversations and organizations? So next slide. I wanted to talk about how, first of all, I wanted to acknowledge the land where I'm in. It really belongs to our coastal Miwok community. This is a land that has been stolen from them, and really just acknowledging that I am in this land that belongs to the coastal Miwoks. How do we understand where we are right now? So there are many sort of explanations, but there are two things that I think for me in sort of doing this work, I've tried to really understand and really believe that two thoughts. One is from John Powell, who is the executive director at the Otherness and Belong Institute, where he talked about the biggest problem of the 21st century really is that we have denied our belongingness with others. So that when we've created spaces where you belong or places where people don't belong, it actually creates a dissonance or an inferiority or superiority. That folks that are actually in that group that where they belong gets more resources, timely access, gets to be taken care of. And if you're seen as not part of that community and that you are an other, that you are not necessarily taken care of. So that disconnection with others, disconnection with ourselves, and disconnection to nature really kinds of have created the situation that we're in. The other thing that I have over time really tried to understand is the history of colonization. And Rupa Marya, or Dr. Rupa Marya from UCSF talks about the trauma that we have faced as nations, as individuals, as communities, are now being seen in the inflammation of the body. So trauma, generations, individuals, historic, are actually now being seen in inflammations in our body that sort of transferred on to genetics. And that if we are to address the trauma that is resulting, the inflammation that's resulting to the trauma, we really need to understand that the basis of all these things that are happening in our community is the colonization of culture and communities, that we have embraced the ideology of supremacy, that we also have embraced the ideology of capitalism. So colonization talks about being disconnected to your culture or your ancestors, right? So this is what John Powell was saying. But also more importantly, that we have created sort of a level of hierarchy in our system where we tell people that you belong, that because you belong, your standards are the standards that we're going to compare things, that you are much better than others, the supremacy, right? In terms of the ideology of white supremacy, that the standard of whiteness is the standard that we are all measured against, that we are also looking at the standard of male supremacy or patriarchy, that our standards are, if you are male identified or the abilities that are associated with sort of the male sex or gender, that you are better. And that is seen through, until now, that women make what, 70 or 80 cents to a man's dollar. And also when we talk about nature supremacy, that we think that we are much more important than nature. And if you are not paying attention to what's happening in this country, right, in many countries across the globe, that we are destroying nature for our own benefit. So for me, that is the framework of how I see this. And unless we have a conversation about these things, we are going to just always talk about have easier conversations. Next slide. So the pandemic has really brought many of the things that we already know, right? And it's sort of interesting to me as I'm really reflecting on what's happening across this globe, is this one piece of tool that is a protective equipment has really unearthed many conversations about structural racism, right? COVID has really elevated the issue that we as a system have really been operating as a broken system. So this, I remind myself that when we look at the mask, that about 13% of our population are African Americans, but 23% of the cases that are reported, the deaths that are reported, are actually African Americans. It also pointed out that the mere being Asian, right, that because of what has been talked about of where the virus has come from, that Asian Americans in this country has received sort of a backlash of xenophobia that's sort of happening. The people were being actually violence against Asian Americans because of what's sort of happening, that it's being attributed to the Wuhan quote unquote virus, right, is being attributed to sort of Asian Americans. And the other part that really made me kind of open my eyes is there was a conversation that I was having with a colleague when I asked him, like, why can't we just wear the mask? And then my African-American friend said, you know, for me, I have to choose exactly whether wearing the mask is a safety issue for me, because if I wear the mask, people think I'm a criminal, right? And people will be suspicious of me. And will I get hurt that way, similar to wearing a black hoodie or wearing a hoodie, or going to a place where I don't have to do it and be exposed to the virus? So that actually wearing this piece of equipment can be a matter of life and death for folks. So this is the setting that we are in. Next slide. Here's the issue. No buts, no. The reality is racism kills. Whether it's through force or deprivation, whether it's through discrimination, right? Force and deprivation is about slavery, of the killing of Native American and indigenous people in this land, the discrimination that many communities, Asian, Latino, African Americans, continue to face. It is fundamental that to understand that the cause and disease of all of these things actually are rooted in sort of racism. Racism kills. And we have to really be bold enough to actually have that conversation every day in every place of organization. Next slide. And it's interesting to me that because we've known this, we've known racism kills, but we actually have a hard time talking about or actually naming it. And in many conversations that I've been, people always talk about, well, let's talk about race. But at some point, they're going to bring about ageism or ableism or social class or poverty, right? And I think it really takes away the fact that we have been as a nation really afraid to talk about the deleterious effects of racism. So we are so afraid, or maybe don't have the skill, that there was actually an article from Health Affairs that came out, I think about a month ago, that talks about how easy it is for us to talk about race, but how uncomfortable we are talking about structural or institutional racism. So in the Lancet, which is sort of one of the most prestigious journal articles, said, we tend to use more race most, but not structural or systemic racism, which ADÈLE spoke about. In a quick search of a website for Health Affairs, which is again another really prestigious journal organization, about 14 pieces of their 39-year existence had only showed about 114 pieces that actually used the word racism, right? And again, in about a literature review from 2002 to 2015, reviewing public health literature, only 25 articles from 2002 to 2015 actually used the word institutional racism. And PubMed, so many of you who have advanced degrees and had to do a dissertation and did all these studies, PubMed is really sort of this really great research tool, revealed when they did sort of a search in June of 2020, that only 86 sort of articles included both race, structural racism, or institutional racism. Only 86 articles. And only 32 of those 86 came within the last 18 months. We are a nation afraid to talk about structural racism. We are a nation that are really afraid to talk about the painful effect and that racism kills. Next slide. So I wanted to talk about, well, how do we do it, right? So that's really why we're here. That's why we're engaged sort of in this webinar, because we don't want to just tell you that it's bad, but without giving you some tools. There are many tools out there, I'll just say, many that I've seen over the years. I'm certainly not necessarily an expert, but have really been interested in how to bring this kind of work in our everyday work as a human being, you know, in my own self-reflection, as a leader in an organization that focuses on behavioral health, as a community member, you know, as part of the Asian American community, the Filipino American community, the LGBTQ community, how to bring this conversation. So I want to offer one framework that I think is really a tool that can help us begin these kinds of conversation or begin this work. So many of you, many of the counties here, maybe hopefully our colleagues from GARE are here too, this national alliance called Government Alliance on Race and Equity. So they are a national network of government agencies that strive to work and embed addressing equity in the work. So first, so I know that Marin County is part of GARE, San Mateo, San Francisco, Santa Clara, Contra Costa. Many of our colleagues sort of are part of this national network. And the one thing that's really good about GARE is they really are focused on public institutions that had a history of perpetuating this racist ideology in this nation. So they define racial equity as eliminating racial disproportionalities so that race can no longer be used to predict success and increase the success of all communities, right? When race no longer determines success, health outcomes, timely access, how we fare, how we live, how long we live, how our health will be, how we show up, right? When race, how we're perceived, how we're treated, when race no longer becomes the factor that really influences all of these factors. So GARE is actually offers one framework that I want to show you today. Next slide. The GARE model talks about 3 levels or 3 sort of circular phases. One is to normalize the conversations about racism. When we do as a community, as a group, as an individual, as a program, have a shared analysis of what we're talking about. We are prioritizing needs of being an organization or a program that really addresses equity, that we really intentionally spend time and resources, build the knowledge and building the skills for folks to be able to have conversations. The use of data and storytelling, not just data, but really that behind the data that we always produce are the stories that really affect us. Our stories of colonization, of standing up, of really asking for help. Those are not other people's stories, they're our stories too. If you do not know the difference between equity and inclusion, if you don't know the difference between equality and equity, if you don't know the understanding or the underpinnings of white ideology and white supremacy, that's where you start. If you don't have the language to talk about these issues, you don't feel comfortable handling the uncomfortable, it would be really hard to really do equity work. The soul searching needs to happen first. The next phase is organizing, right? Organizing means you cannot do this work alone. We need each other to change the narrative of people's stories. Yes, as a therapist, I believe that one person can make a difference. But what we are talking about, and as ADèLE was talking about earlier, it's the structures that need to change also. What happens is you have heroes and champions in this equity work, but when they leave the organization, so does the work leave. The work goes away. And it becomes an individual perspective or individual task to be more culturally competent or culturally humble. But really, it's the organization's responsibility to support all of us so that we can do this work. So even when we're no longer here, the work continues, the stories are changed, people thrive, communities are engaged. Organizing is really key in terms of the GARE model. Coming together as collaborations, bringing grassroots communities, people with lived experience, people who have been hurt, law enforcement, libraries, professional institutions need to come together and say, what can we do together? Because I might be in an institution that's really focused on equity and behavioral health, but I know my clients go out, go to the library, encounter law enforcement. So all of us really need to be partners. We need to build internal sustainable structures. We need to build sustainable structures. Next part, again, this is sort of a circular process, is operationalizing what we mean by racial equity or racial justice. What do we know? How does it look like when we've achieved it? What are the benchmarks or the milestones that are meaningful, not just to us, but to the community, right? What does it look like to be an individual or a leader that embraces racial equity? What does it mean to be an individual who is immersed in white supremacy, right? They sort of internalized it, and helping allies to build allyship. What it means to be as a person of color that's trying to navigate their own world, right, in an area or ideology of whiteness. What does it look for a white ally that says, I want to be a partner in this role of social justice? We need to understand what that looks like. What are the behaviors? What is the structures that would look like? One of the things that the GARE talks about is really using a racial equity tool, that you make decisions based on certain guidelines. When you are contracting, when you are eliminating positions, when you are bringing on people to look at, are you being influenced by your implicit biases? Have you created policies and practices that actually shun people out and other people, other communities? What are the things that you need to change? One key there, as I said earlier, is data. I also just want to warn you, it's not just all about data, because oftentimes I'm sitting in meetings, they always ask me, well, what's the data say? It can be just numbers, but really, what really is more important is the stories of people behind those data. Another thing that I want to just say is, when we talk about data, it literally just talks about the people that's in front of us, the people that we engage. But there's a whole group of communities that have not been engaged by us because we have done a poor job engaging them. Or historically, that they have had so much negative experiences with us, they don't want anything to do with us, right? How do we get those voices onto our table so that the data that we have reflects not just a particular group of people or the squeaky wheels, but the data where all the community, all folks are involved, because it's actually their lives that's going to be affected. So that's the GARE model: normalizing, organizing, and operationalizing. Next slide. So I wanted to break it a little bit more, right? I am a person that thinks in schemas. It's easier for me to digest things. To really talk about, in terms of all of this, what do we do, right? And I have always loved the social ecological model. And when we talk about social ecological model, it really talks about the relationships of our behaviors and outcomes. What is the relationship of our thinking or what we do in each of our layers, right? As an individual, in relation to others, as a relation from institution and structures. So this particular slide talks about, well, how do we address the issue? ADèLE already talked about the levels of racism, right? That there is an internalized racism, there's an interpersonal racism, there's institutional racism. There's really structural racism that continues to exist in many of our communities and our societies. And so I want to offer this as a starting point for you to think about, as an organization, as an individual, what you can do to begin the conversation, to normalize the conversation, to operationalize what you're thinking about in addressing equity. So on the first level, right, your own internal self, because I really believe that leadership starts with the self first. It's always about a self-reflection. What is about my biases? What is my belief about individuals in the world? What are my stereotypes? And how do I stop that? There's a lot of control here in this section, or in this level of social ecological model. You have control with a lot of things about your life, some degree, about how you can be a change agent. The next level is our relationships with other people. How do I show up in other people, with other people? How do I show up in meetings? Like, people of color historically have only shown parts of themselves in meetings because they're always afraid, cautious, that their full selves might not be accepted, or because they've had negative experiences when they've showed everything about them and that they've been shunned. So oftentimes, people who are marginalized often show up with parts of themselves. And can we create a society or a culture where we show up with our full selves? When we talk about interpersonal, we also are talking about microaggressions. How do you show up in meetings? How do you treat other people? Right? Do we recognize when we are oftentimes committing microaggressions, when our intention is really good, but it doesn't land positively? How do we change that? And what is the conversation that needs to happen when you've offended somebody? Those are hard conversations. The next level is institutional level. And many folks here who are administrators or sort of leaders, it's to think about, what kind of culture are you creating in your organizations, in your programs? Are there biases in your practices and policies that continue to create walls for people to thrive, for people of color to move up, so that your leadership reflects the community that they're serving? Have we created these unnecessary barriers that keep people where they're at? And then the last one, because again, we can't do this just in our own organization or program. We have to partner with different structures, law enforcement, schools, right? Because many of our clients, actually all of us, go through different places. So they might feel that your organization is racially or culturally humble, but when they go out, they're being stopped at a stop sign, or partnering with organizations really is the key to really change the narrative of all people. So I want to just offer that as a framework for you. So I really believe oftentimes people are struggling, like, where do I start? Actually, you can start in all levels. Right? Oftentimes I hear, well, I can't do anything because policies need to be changed. And I want to provoke you and ask you to think about it differently, that actually, even if the policies don't change, you can still do something different. It would be great if the policies change, but you on your own can really make a difference. Next slide. I want to end with one of my favorite, people who know me, I never end without saying a quote. And these quotes really inspire me. And if you heard my bio, really, for me, it's really just justice and love. And Cornel West, who is a really key figure in racial justice work, said this, that justice really is the public face of love. And I really believe that if we truly understand and do the work of loving people, we'll create a different community and different narrative for people. So I want to turn it now back to my colleague, ADèLE.
Great. Thank you, Jay. So, the way this series has been designed is that each webinar, we're going to be concluding it with a call to action. And so something that you can do, but that it correlates with where the intention of the webinar. And so something for you to consider doing in your organization or as a group is a conversation about the racial scripts and your early socialization around race. Some of this is about writing, what do you remember? What's your best guess about the racial scripts and what you remember about that? So the instructions, respond to the prompts, and it's okay if you don't know a lot about your early socialization. In those cases, write about your best guesses or talk about your best guesses of what those racial scripts were. And so looking at your first socialization, how we are socialized often comes from our families, it comes from the neighborhoods that we live in, it comes from the institutions that we attend. It can be written, it can be unspoken, and there are these rules about race. So racial scripts can also be explicit through verbal messages about your race or other races. Even the absence of exposure to other races serves as a message. So encouraging you at a personal level, if you've not thought about this, to what were those scripts? And what did I pick up around me? What were those expectations and the norms of those scripts that I was taught? So encouraging you to think about that as a conversation, with your colleagues, if this is the work that you want to do in moving forward on dismantling these structures that inhibit so many communities from access to equitable, appropriate health care and mental health services. Thank you. So I think it's time for questions.
It is time for questions, and I know that Jay is going to come back on. First, Jay and ADèLE, I want to thank both of you so much. These were really thought-provoking presentations, and it's definitely reflected in the questions that came out. I'm going to start off with a question, and I'm going to hand this one first to you, Jay. How does white privilege impact leadership who are predominantly white in the organizational implementation of programs that are intended to address racism in behavioral health?
Well, I think that in itself is the start of the issue, is right, that we are seeing the lens of whiteness, that I actually will come back to not just the white privilege. I think it's really the ideology of whiteness, that I said that we cannot really address these issues without understanding what is that standard and what is that lens. So I often talk about, well, what is, what is the standard when we create our judgments, for example? So I think the first thing, and that's why the GARE model is really important, is normalizing the conversation, right? Really saying, when we make decision, we ask the question, where is that coming from? Is that from your own lived experience? And what about other questions? Who's going to be impacted? Why did you make decisions? Really asking why helps with that. We are in a culture, and I'm just going to say this, that we actually are afraid to ask why. Well, why did you think that way? Not in a punitive way, but because I really want to know. So I know that many of our institutions are led by white colleagues. And I think it's really a deep soul searching, that if we are an institution that really serves the underserved, or the ones that communities that are high disproportionality of poor outcomes, that we need to think about what's the lens that they're seeing the world, and maybe begin that. So I think a conversation, education, do some soul searching is needed. But I also think part of that soul searching is really thinking about, well, what would this look like for us if we are a racially justice focused organization, looking at it from a white, non-white, more diverse perspective.
Yeah, exactly. Thank you so much. ADèLE, this is a different question. This is coming from a community trainer, and this trainer is developing a training on implicit bias. There's a person who's been attending their trainings who's a woman of color and resists the idea of structural racism because she says she has personal responsibility for her circumstances. How do we address structural racism without making people of color feel powerless or not in charge of their own success?
So say that again. Can you repeat it to me again? Yeah.
Sure. The participant wants to know, how do they address structural racism in a training? And if there's a person of color in the training who resists the idea of structural racism because they feel like they have personal responsibility for their circumstances, how can the trainer allow people to be able to, how can the trainer move forward with the training and not make people of color feel powerless or not in charge of their own success?
Yeah. So I would say that, it's such a large issue that part of it is looking at how you work with others, and that the responsibility isn't just on people of color. I think sometimes I have a lot of trouble with where the expectation is that it's people of color who are going to handle it, or they're the ones who need to go to the training. And so I think part of this is this call for whites to step up, those who, the allies to step up, and recognize that you actually have access and also participate and move things where someone else might not be able to. And so I think that is one. It's about helping folks see what the structures are and the impacts, but that it is actually a broader group, because we see this playing out not just on the basis of race, but we also see this on the basis of gender. We also see this on the basis of sexual orientation. We also see this on the basis of disability, and immigration. And so I think it's like, what's your role, the rest of folks, in supporting others to create an environment that is equitable for all? And so I think it's not an easy question. I think we still have to have the discussion, but it is also the courage of the facilitators to help others your privilege. Hmm. Did any of that come? Was that garbled?
Yeah, unfortunately, we're having a little difficulty with your sounds, ADÈLE. And so I'm not sure if it's the fact that we have our phones on. So what we'll try to do is that we'll mute when someone else is speaking. Great. Okay, Jay, here's another question. One of our participants needs clarity on the claim that if a disparity exists between racial groups, it's because of racism. Do disparities not always exist between and within groups of people? For example, income levels of white Irish descent compared to those who are white Italian descent. To be clear, racism is in me and our society everywhere, structurally, institutionally, etc. I'm just struggling with the premise that if a disparity exists, it's because of racism. Can you respond to that one?
Yeah, well, there is a piece about, I think, really understanding sort of the complexity of like where we're at, right? So, and I'm gonna try my best to make it simple. So when you see one person, like for example, in a clinic and say they're not doing well, you ask the question, well, why are not they doing well, right? So that's, and then when you start looking, so the question like, well, maybe, the house that they live isn't right or whatever, right? So you start asking, well, what are you doing? What's your behavior? And so the next day you started noticing there's like a group of similar folks in the same, let's say, race, right? Who are kind of affected by the same thing, right? Whether it's housing, access to food, behavioral health outcomes. So you're thinking, well, I wonder if there's an issue here with the house that they're living in the dormitory, right? Because now it's people of the same are kind of here. And then when you're out in the community, you notice like people who are living in different sort of places are kind of experiencing the same issue. So you're not necessarily saying it's just an individual behavior. You're noticing of a pattern. So in this country, African Americans and people of color have disproportionately had poor outcomes, right? And if you look at the social determinants of health, right, and that talks about what determines people's health, it's not necessarily just the behavior. What we're saying is the system, housing, healthcare, law enforcement, businesses, right, education, are all kind of rigged to some degree and disproportionately affect them. Does that make sense? And I think that's the issue, is the commonality of who really gets to be disproportionately affected. It's just telling you that it's not just the people itself, it's the infrastructures that continue to either support them or don't support them. That's, I think, where the problem is. And that's where racism is. Historical also, and I'm not a history expert, but when the first settlers came here, right, they created sort of this superiority already by bringing in slaves, right? And they already started saying, you don't have rights. You're actually not a human being. You're property, right? And over time, we as a nation have created these policies, redlining, Jim Crow, to actually put people that fits that criteria in boxes so that they can do better, right? So I can be, a really hardworking person, right? But I know at some point I will find a glass ceiling because as an Asian, how many Asian Americans have ever become president of the United States, right? How many transgender individuals have come to mainstream or to lead organizations? In California, 1. So what I'm saying is we've created all these rules and policy that actually have put barriers for folks to actually move to different spaces. Just think about it, right? I think that's the part that's missing, is because I can be a hardworking person, but I know that when I'm applying for a job, the mere fact that my name sounds African American, there is a 25% chance that they will not call me back compared to my white sounding name colleague that have exactly the same credentials. So for me, that's where the structural racism comes about. And also that ideology of like what the standards that we've created. I think that's the piece that's hard. And I think people are struggling with that, right? I think that's the changing of the narrative that really needs to happen. So if you look at the Native American population too, I mean, we've wiped out whole tribes. We've stolen their land, right? And then you say to them, well, why can't they move up? Well, we've brought disease to them. We've taken away their culture. No wonder it's hard for higher rates of alcoholism. We brought them to, well, not me, that was brought them to their community. So can you understand why they're there? And I think that's the soul searching that means. It doesn't mean that you're racist. It's that we are all socially racialized to believe that there is this hierarchy that we need to continue, that we're in, that we need to continue to perpetuate.
Excellent. Thank you, Jay. ADÈLE, one of our participants wonders how behavioral health organizations can create more opportunities for people of color to access the educational and internship pathways towards becoming behavioral health providers.
Yeah.
Can you speak to how behavioral health organizations could do that?
Yeah. So it's interesting because these conversations come up a lot about how to diversify. And one is, to start with, what are some of the associations for folks in behavioral health? So there is an association for African American psychologists, and but there's also historically Black universities. But just because you open the doors and want to invite people in, doesn't necessarily mean that they will come and they will stay. And that is really critical right there. So it is not just about the hiring, and that's a logistics piece. I think that one can, and even within your organization, do you have? I think of one group that has organization that has a leadership program for its staff to support them in their professionalization, or even mentoring and understanding how to move up. I wouldn't be where I am if there weren't people who had helped mentor me, because this is not something I'm doing that anybody in my family has ever done before. My father doesn't understand what advice I have to offer that people would pay me for. So, to have mentors, but I think you need to take a look at internal to your organization. Is it welcoming? Is that person going to feel comfortable? Have you already had these conversations about race and its role in structuring the organization, its role in informing your policies and practices, in terms of, does HR know what to do if an incident were to come up? And so, someone doesn't want to show up and be, that individual where you get your agency is practicing this. So I think it's, if you're having your relatives over, you're going to clean the house. You're going to figure out what they like to eat. You're going to cook the food in advance, because when they come over, you want them to have a good experience. It's the same thing with your organization.
Thanks, ADÈLE. Really, really great answer. Okay, this is going to be our final question, and I'm actually going to ask both of you to respond to this. One of our participants said, I must admit that this training has triggered emotions. Do you have recommendations for where our participants can go and what they can do when triggered by discussions of racism in behavioral health? And Jay, why don't we start with you, and ADÈLE will finish with you.
Yeah, that is the question that I think we really need to spend a lot more time. You cannot do this work unless you take care of yourself. I mean, that's the issue. Like, this is a long haul. And for people who have been fighting this and bringing this up, I actually give my props and my recognition to continuing the work. And I'm going to say that I'm working on this as well, to just really care for to care for yourself. I have been, as a leader, challenged. On one end, I need to appear confident and all together all the time, and I've come to realize I can't. And to be authentic to my staff and saying, I'm struggling today. It's a hard day today, because it gives permission for other people to also say, God, I'm not 100% today. So that's, I think, the kind of thinking that I'm trying to do differently. So find that space within yourself or organization to permission to say, I'm not giving 100% today, and it's okay. And what can you do to help that other folks when you have another hand to extend? Because sometimes, to be honest with you, I want to come home and I binge on Netflix, right? I don't want to deal, and that's fine. I also think finding mentors, and I think ADèLE said that earlier, find somebody that you can talk to, right? It doesn't have to be about work. It doesn't have to be about racial justice. It can just be like, man, my sandwich is bad today, right? That, right, is because you really need the opportunity to just de-stress, because this is so stressful. And my last comment is my plea. I believe that all of us has actually a role to take care of each other. We have forgotten that, right? That we are collective. We should be looking at this from a collective opportunity. That we, from our ancestors, were born to care for each other. And this concept of being individualistic has really killed us and is killing us. So for me, a reminder that when I ask people, are you interested in the work? I appreciate the one that's raising their hand, but I will much more appreciate somebody says, I want to do it, and can I involve other people? So I'm not interested in sheroes or heroes that are martyrs. I'm interested in people that can bring people together and say, let's do this together. And for me, that's how you take care of each other.
Thank you. That's an excellent question. And one of the things that for people of African descent in the audience, one of the things that I found was something called Safe Black Space. And this started after the murder of Stephon Clark here in Sacramento. And I needed some place where I could go and just be, and where I knew others understood what was going on for me. And so if you go online, they're all over the country. And so to Google Safe Black Space, I would say for whites, is there a group and that you can meet with, bring some together and do some reading on the topic? That this is something that can come up, I think for folks who are white, of feeling guilty. And no one is saying that you are responsible for hundreds of years. At the same time, based on the privileged experience, there's some work that needs to be done. And so, mentioning the Truth and Reconciliation Commission, like recovery, like you take an inventory, and then where do you want to move from there? One of the things I've taken to doing when I'm doing these trainings, these all-day trainings, is, have people in small groups talk about how are you doing in the midst of all of this? Because I think people are holding on to, and especially now with this COVID and where you don't get to see each other, you're more dealing with this in isolation. So finding like needing to change it up, so that folks have a chance to share how are you doing and what is going on. And then in a later segment, talking about what are the things that help ground you and give you peace. And a reminder to go back to those things. A piece though that I don't want to miss is that we can often view dealing with these issues as strictly an intellectual exercise. And so if you are feeling triggered right now, to put your feet on the ground, sit in a comfortable position and breathe and pay attention to where you're feeling that. Do the things that soothe you. That's what I would do. And for those therapists out there, I have to say my therapist is white. I've been challenged to find one of African descent. What struck me though about her, and I remember she asked me whether or not it mattered that she was white when I started working with her. And I was like, no, that doesn't matter because I need you for something else. But the fact is that when we ran into a bump, because she had brought this up, I was more trusting of her. But not only that, what I've been struck by is her acknowledgement about what's going on in the rest of the world. And so when things have occurred, you know, like George Floyd, I've been thinking about you. Are you okay? Do you need to talk? You know, that's not something I necessarily want to go talk to her about. But let me tell you how it made me feel that she actually had some understanding about what was going on in my world made a huge difference.
Really wonderful. We are at the end of our time. I do want to mention just two things quickly before ADèLE and Jay leave us. One is that there were a number of comments about kind of questions about racism is not exclusively for Black Americans. An example, there was no mention about the effect of COVID-19 on Latinos. And so in this period, how do we address anti-Blackness and racism impacting all Black, Indigenous, and people of color? Not to be responded to right now. We are very, very lucky that we have Jay, who's going to be coming back in our webinar series. ADèLE is going to be facilitating many of our webinars. And so I just did want to let people know that we do a lot of planning for this, and we are going to discuss this, and it will come up in future webinars. The last thing that I do want to do is apologize. There was one of our participants who really needed to have closed captioning. We are offering closed captioning in the recording, but we didn't have closed captioning for this webinar, and I do want to apologize about that, and that we will work our internal team in CIBHS to attempt to do real-time closed captioning, at least for the remaining 3 webinars. If we could do it by next week, that would be great. But again, I apologize on behalf of CIBHS. All right, with that, we are going to be finishing up our day. ADèLE and Jay, thank you so much. I know you're both really busy, and so if you need to run off, then that's fine. I do also really want to thank the Department of Healthcare Services. They're sponsoring this webinar series, and that